Well, clearly it can be a bit awkward, this new normal, getting on our online get-togethers, but there are some real benefits in getting together virtually. And at this stage of COVID-19 pandemic in Tasmania, we are now able to gather together in regulated and physically distanced groups. But as we've seen in other places around Australia, the threat of COVID-19 isn't over. And so with that in mind, the Menzies Institute for Medical Research will not be holding any in-person public events for the remainder of 2020. And like today, we'll continue to use technology to share our latest research advancements and connect with you, our community. So this afternoon, I'd like to express my personal thanks for the wonderful opportunity to celebrate the power of philanthropy and thank many of you here today who have been long-time supporters of the Menzies Institute for Medical Research and our university. People are at the heart of what a university such as ours is all about, and together, we as a community create opportunities for our students. Therefore, your philanthropic support is really a tangible manifestation of how we create opportunities, and it's essential in ensuring that our students meet the standards of international excellence that you are helping us achieve. Without people like you, simply, we would not be the very special institution that we are. And indeed, one of the great joys of my job is hearing how your giving is making a difference. Today, we're going to hear from 5 exceptional students, many of whom are part of our international cohort, here in our island state, making a difference to the wider world. Now, it's my pleasure to hand you over to Fiona, who's going to introduce our first student speaker. Thank you.
Thank you so much, Rebecca. Hello, I haven't met many of you, I don't think. My name is Fiona Ewing and I'm the Community Engagement Officer for the Menzies Institute for Medical Research. And I'm also here supporting Jane Richards, our Advancement Officer, with this event. Jane's done all the hard work and I just get to speak and fluff about with my arms because I find it difficult to keep them down. Look, I'd really like to echo Rebecca's sentiments and warmly thank you for sharing your time with us today. And it is my pleasure to introduce you to our impressive young students. Shortly, they're each going to give a short presentation about their research. And if all goes according to plan, we will have about 25 minutes at the end for questions. So if you have a question and you're happy to speak up, just type your name into the chat function at the bottom of your Zoom screen and then we can call on you in order. If you would rather just type in your question, absolutely feel free to do that. So as we said, our sessions today is being recorded so we can share with others who are unable to make this time. So you can always stop your video in the bottom left-hand corner. And I would ask that everyone mute themselves so that we can avoid any of that background noise, like the rain that's just started falling on my tin roof. Anyway, without further ado, I will now introduce our first speaker, Bruna. And I'm just looking for that Word document. So Bruna Silva Ragaini, I'm not sure if I said it at all, Bruna, you'll have to say it properly yourself. So Bruna's PhD project is describing the incidence of skin cancer in Tasmania, the most common type of cancer in white-skinned populations, which affects half of Australians by age of 70. Using population-level data, she's examining trends over 40 years and how these have changed by age, sex, and place of residence. So Bruna's academic background is in demography, a discipline that's easily applied to many fields. It's opened the doors for her to work in various projects across the University of Tasmania over the years, from tourism to sociology and public health. Keen to further her education and career in research, she found epidemiology to be a good fit for her skills, but also a fascinating field where research can have a real impact on our population. So I'm going to hand over now to Bruna.
Thank you very much, Jane. That was a good effort there in trying to pronounce my name. Let me just share my screen. All right, can everyone see that? Yeah. So my name is Bruna Silva Ragaini, and I'm very pleased to be here today to talk about my PhD project and what the scholarship has meant to me. So my PhD is investigating the incidence of skin cancer in Tasmania, and I'm particularly interested in the two most common types of skin cancer, which are basal cell carcinoma and squamous cell carcinoma of the skin. Together, they are known as keratinocyte carcinomas. Now, as Fiona mentioned, this is the most common type of cancer in fair skin populations. And in Australia, half of the population is affected by the time they turn 70 years old. Now, you might be wondering whether we need to worry about skin cancer here in Tassie, given our climate and location so far away from the equator. And the answer is yes. So in 2018 alone, there were more than 14,000 episodes of care where patients got diagnosed with at least one, but often multiple keratinocyte carcinomas in Tasmania. Now, these numbers are not as high as the ones we see in Queensland, for example, but they're still very high by international standards, and they place a huge burden on our population. So what I spent the first year of my PhD doing is compiling a data set of all histologically confirmed cases of keratinocyte carcinomas in Tasmania since 1978. And I'm just about to start analyzing all this data to examine how incidence has changed over the past 40 years, including differences by age, sex, and place of residence. Now, I hope that the findings will help inform clinical practice, but also assist in the effective allocation of resources and the better targeting of awareness campaigns in our state. You know, when I first immigrated from Brazil in 2007, I found myself in complete awe of Tasmania's natural beauty and absolutely delighted by the warmth and friendliness of the Tasmanian people, who I feel really welcome me with open arms. So today, over a decade later, I am very grateful for my scholarship donors, because they're not only giving me the opportunity to further my education and career in research, but they're also giving me the opportunity to give something back to this community by tackling such an important public health issue. So thank you very much. I really appreciate it.
Thank you, Bruna. And now our next speaker is Tram Nguyen. Hope I've got that one right. Tram aims to investigate if the application of a non-invasive technique, repetitive transcranial magnetic stimulation, can increase oligodendrogenesis and remyelination in a mouse model of demyelination. Gosh, that's a mouthful. As repetitive transcranial magnetic stimulation is already a clinically approved treatment for depression, positive outcomes in the preclinical study can be translated to the clinic for the treatment of patients diagnosed with multiple sclerosis. Thank you so much, Tran. The floor is yours.
Thank you, Fiona, for introducing me. Yeah, so I just share my screen now. Yeah. So it's a really great honor for me to be here to just talk about my PhD project. And actually, this is about to determine the effects of transcranial magnetic stimulation in promoting brain repair in multiple sclerosis. So what is multiple sclerosis? Typically, multiple sclerosis is a neurodegenerative disease that disrupts the flow of information within the brain and between the brain and the body. So when we're looking at the neuron itself in healthy central nervous system, which is on the left side, normally the information is transmitted from one end to another end of a neuron through a long slender projection that we call axon. And oligodendrocytes, which is labeled in the green one, are responsible for generating myelin, which ensheaths around the axon, thereby enabling the transmission of information reliably and quickly. However, what happens in neurons in multiple sclerosis patients? The oligodendrocyte die and myelin is damaged, which we call demyelination. As a result, the transmission of information happens slowly or even stops. So what I'm gonna do during my PhD project is to use an electromagnetic coil, which is very small, to apply it over the head of a mouse or human to see if this technique can promote the survival of oligodendrocyte or trigger myelin adhesion to an axon itself. And further, if this technique can improve multiple sclerosis symptoms in patients like fatigue, depression, or cognitive impairment or not. So I have to say thank to a scholarship donor that offering me this scholarship, so I could be able to contribute myself to work and somehow give back, some like bring some benefits to multiple sclerosis community. And I have to say this has really helped me like reduce the financial burden during my time living in Australia. So thank you very much. Yep.
Thanks so much, Tram. That was great. And our next speaker is Rajya Gurung. So Rajya is an ophthalmologist originally from Nepal, and she used to treat many diabetic patients with lots of eye problems due to diabetes, and many patients used to go blind. This led to further research in this field, which she will share with us today, I'm sure. So in her spare time, she loves to read books of all kinds and watch cookery shows. Yes. And apparently she says she's a very bad cook, but I don't believe her.
Thank you, Fiona. Let me share my screen. Good afternoon, everyone. I'm Rajya, and I know I'm truly honored and humbled to be able to present to you all this afternoon. And at present, I know everyone is speaking only about COVID, but I feel the only disease which is more pandemic than COVID at present is diabetes. And diabetes is a major health issue worldwide, and Australia is no exception. Here in Australia, diabetes is the fastest growing chronic condition. Here we have 1 person every 5 minutes, that is 280 Australians develop diabetes every day. And the total annual health cost impact of this disease is estimated close to $15 billion. Now, diabetes can affect any and every part of our body, and my PhD is related to a very common eye complication related to diabetes. For the ease of understanding, our eyes can be compared to a camera. And just like in a camera, the image is formed behind on a thin film. Similarly, in our eyes also, the image is formed on a thin structure called retina. Now, in diabetics, there is collection of blood, lipid material, as well as fluid, especially in the central part of this retina. And this condition is known as diabetic macular edema. Now, patients of diabetic macular edema, they have blurred and distorted vision, and many patients, they lose only their central vision. And this condition is the most common cause of vision loss in diabetics. Now, we have treatments available for this condition, and the treatment works pretty well for most of the patients. But we have a small but significant number of patients for whom this treatment doesn't work so well. And these patients can go blind. So my research is trying to find out as to why the treatment doesn't work for everyone. And researchers like me, we believe that our genetics has an important role to play in as to why some patients, they respond to treatment, whereas others, they don't respond to treatment. Now, I have completed my first year of PhD, and the experience so far has been pretty overwhelming, especially when I go to clinics to recruit patients. Then it's really heartening to see all the patients so happy and willing to take part in our study. Not because it will be useful to them, but because they think that it might be useful for someone else in future. And as Fiona said, before I moved here permanently to Australia for my PhD, I was a clinician back in Nepal, but research was and has always been my passion. But to do a transition from clinics to purely research would not have been possible without the scholarship. And I'm truly grateful and thankful to you all for giving me this opportunity to pursue my dream. And I know there's a lot I want to share, but everything can't be expressed in words. But hopefully with my research, I'll be able to help not everyone, but a small group of people, and maybe I'll be able to make their life a little bit better with my research. Yeah, thank you.
Thank you so much, Raja. Okay, our next student I have the pleasure to introduce is Stan Drummen. He comes from the Netherlands, where he studied physiotherapy and worked as a physiotherapist for a couple of years. So physiotherapists have to work evidence-based. So Stan knew that if he wanted to have an influence in his field of expertise, he would have to engage in a research degree. So Stan wanted to combine this goal with the experience of studying abroad and has always been attracted to this part of the world. He found the project at Menzies and was just what he was looking for, and he's supervised by really highly experienced people. So take it away, Stan.
Thank you very much. I'll start sharing my screen. Okay, so I'm working on the WALK study, which is a pilot randomized control trial evaluating community walking for knee osteoarthritis. And I'm doing this under the supervision of Professor Dawn Aitken and Professor Graham Jones as part of my honors in medical research. I wish to thank you all very much. The scholarship enabled me to take part in this project, and it has been a great experience so far, so I really appreciate it. So some background on osteoarthritis. It is a leading joint disorder which causes pain and functional restrictions in the people who suffer from it. And it is multifactorial, but the major risk factors are age and obesity. As we all know, in many Western countries, the population is aging, and there is also a high rate of obesity. In Australia, more than half of the adults is overweight or obese, and this is marked in Tasmania. The most effective treatment for knee osteoarthritis are knee replacements, and we can see a rapid increase in the number of knee replacements annually. And recent studies have shown that many people that undergo a knee replacement or take medication for osteoarthritis haven't tried losing weight or exercise first as treatment. Even though these are strong recommendations by national guidelines of, for example, the RACGP or international guidelines, and these recommendations are made because plenty of evidence suggests that exercise can reduce knee osteoarthritis symptoms. However, there is no definite data on the structural benefits, and this makes some general practitioners and patients insecure that exercise might be damaging to already worn joints. We examine walking because it's a light and cyclic form of exercise, but it still requires weight bearing. Osteoarthritis is slowly progressing, therefore the intervention takes 24 weeks. And here you can see 2 X-ray images, but we look at changes on MRI images. So currently, our recent systematic reviews have tried to summarize RCT evidence, and they say that it's of low quality currently due to limited generalizability in types of exercise and patient groups that are being assessed. So if you examine many different exercises, it's hard to apply your findings for a specific exercise. And there's often a low level of adherence to the intervention, which also makes it difficult to interpret the findings. So this is a pilot study to see if our design is working well. And if so, then I hope we can apply it on a larger scale and soon get a better understanding of the relation between structural osteoarthritis progression and knee and exercise. Thank you very much for listening.
Thanks, Stan. Much appreciated. Our final student for today to do a presentation. This particular presentation is already being recorded online, and I'll let Myles talk a little bit about that. So Myles' PhD project focuses on health outcomes related to high blood pressure. More precisely, Myles is investigating how blood pressure measured during exercise, such as walking, running or cycling, is a new marker for identifying and managing the risk related to blood pressure. Myles' interest in this area of research stemmed years before Myles started his PhD. He was first introduced to this area of research when the Mercury newspaper published an article back in 2014. In late 2018, Myles gained his accreditation as an exercise physiologist and saw firsthand how the research considered in the 2014 Mercury article was relevant to his everyday clinical work. So I'll hand you over to Myles, and then when he's ready, I will share my screen with his recorded talk.
Awesome. Thank you very much for that introduction, Fiona. Greatly appreciated. Before I pass on this video that I've done, I would like to thank my scholarship donors. With the COVID pandemic, a lot of exercise physiology clinics shut, and they've really struggled with finances in that consideration. And so when I reflect on where I might be or might have been, if not for doing the PhD and getting this scholarship, I would be in that same struggle. So I would like to thank my scholarship donors with that. Now, we know that cardiovascular disease like heart attacks and strokes are the leading cause of death worldwide, and high blood pressure is the leading cause or the leading risk factor related to this risk. So today's presentation that I've done is my entry to the 3-minute thesis competition, which is a presentation on how to give, or giving your thesis, being 100,000 words or less in 3 minutes. So I hope you enjoy.
It was the concert everyone wanted to see. One show only, a night no one would forget. This was the night the Wiggles were performing for bushfire victims earlier this year. The Wiggles had just finished their last song and were walking off stage when, out of nowhere, Greg Page has a heart attack. Now, luckily, Greg survived, but it is events like this which reminds us which heart attacks can happen to anyone at any time. So could you predict if Greg was about to have a heart attack? If Greg was sitting right there next to you, you'd be thinking, he's pretty healthy. So how could we actually pick up that Greg had a heart problem before the concert? Well, exercise tests are used in gyms and hospitals every day. They provide doctors with warning signs for the risk of a heart attack, which aren't seen when someone's just sitting in a chair. My PhD aims to predict a person's risk of a heart attack using information collected from these exercise tests, specifically the measurement of blood pressure. So how have I done this? Well, we know that factors like heart size, artery wall stiffness, glucose and cholesterol are all factors related to a person's risk of a heart attack. So I searched for already published research and combined all these results together to determine whether these risk factors were related to blood pressure measured during exercise. And what did I find? Individuals who reported as being healthy but had high blood pressure during exercise actually had larger hearts, stiffer artery walls, and poorer glucose and cholesterol levels. Put together all these characteristics and we've found someone who's at higher risk of having a heart attack. But importantly, these individuals had normal blood pressure when they were just seated at rest. They were asymptomatic. No one could pick it up otherwise. Which brings me back to Greg. Sitting in a chair next to you, you'd be thinking he's pretty healthy. If we had gotten Greg to do an exercise test before his concert, we may have seen that he had high blood pressure during exercise and potentially prevented his risk of a heart attack. But we can save more people than just Greg. Healthcare professionals around the world will be able to use this information to predict the risk of a heart attack, where high blood pressure during exercise can be a new warning sign for predicting the risk of a heart attack and save people like Greg. Thank you.
So thank you so much, everybody, for joining us here this afternoon. Thanks, Fee and Jane, who are doing all the back end and coordinating it all to be here. Thanks, Coots, for joining us as well. It is really important to have our most senior academics joining us and seeing what our young academics are doing here this afternoon as well. So thank you all.